Assalamu alaikum. I'm going to be discussing childhood psoriasis today. So as you're all aware, psoriasis is a common, chronic, inflammatory, immune-mediated disease with a prevalence of 3%. 1/3 of cases of psoriasis in a dermatology center are pediatric. Of the pediatric population, about 0.5 to 2% is affected by psoriasis. The prevalence of childhood psoriasis is higher in European countries, older children, and girls. So we performed an observational study on a total of 131 patients under the age of 18 years who presented with psoriasis to the dermatology department, PEMH, between 2018 and 2023. We described them, classified the pattern of psoriasis, and noted all their demographics, which, beginning with the age, their age ranged from 2 months to 18 years, mean being 10.73. There were 3 infants in our group of patients. Mean age of onset of psoriasis was 1 month to 7.92 years, mean being 8.53. There were 81 women and girls. There were 81 girls and 50 boys. Ratio 1:1.6. Boys ranged in age from 18 months to 18 years, mean 10.74. Girls from 6 months to 18 years, mean 10.79. So girls were slightly older than boys, although the difference was not statistically significant. Similarly, age of onset in boys ranged from 1 month to 17.75 years, mean 8.17, and girls had a slightly higher age of onset, mean 8.75 years. As comparing our data with international data, we found that an Indian study had reported the incidence male to female ratio of 1.09 boys to 1 girl. The age of onset ranged from 4 days to 14 years, and again their age of onset was similar to ours, 8.1 in boys and 9.3 in girls. An Australian study found an equal gender distribution among children for psoriasis. The clinical types of psoriasis we saw, 81% was chronic plaque psoriasis. As you all must have observed, this is the most common pattern seen, followed by 8 patients had guttate psoriasis, 4 each presented with inverse and pustular psoriasis. There was 1 patient each of unstable, napkin, palmoplantar, plaque psoriasis, and 1 patient with guttate and inverse psoriasis. An Australian study found as well that 34% of the children presented with chronic plaque psoriasis. Smaller childhood studies showed plaque type rates of 61, 69, and 84%, sort of similar to ours. And then another study in India showed plaque psoriasis as the most common type, followed by guttate and pustular psoriasis. There was no family history of the disease in 82% of patients. 10 patients had family history positive in first-degree relatives, meaning either parents or siblings, while 14 patients had a positive family history in second-degree relatives, meaning their extended family, grandparents, cousins, and aunts and uncles. The Indian study that I just quoted showed a 4.5% incidence of a positive family history, while another study in the British Journal showed a 48.8% of a positive family history. So our incidence sort of falls between these two. Ours is 18%. And then an Australian study found the highest rate of family history positive being 71%. Now that is really huge coming from Australia. 75% had normal nails. 25% had nails with psoriasis. Pitting was by far the most common change found in most of the patients, followed by 1 patient each with Bewes lines, pitting plus onycholysis, and pitting plus onycholysis plus subungual hyperkeratosis in 1 patient. In a study from Greece, psoriatic nails were found in 11.8%. An Indian study showed nail involvement in 31% of cases, and again, pitting was their most common nail change, followed by ridging and discoloration. A French study found that nail involvement was more common in adolescents, 37%, as compared to children, 32%, as compared to infants, 14.8%. And boys were affected more than girls. However, we found no such gender association with nail psoriasis. There was no arthritis in 98% of patients. Only one patient had asymmetrical oligoarthritis, while 2 complained of arthralgias. A study from Greece found an incidence similar to ours. Their incidence was 0.7%, whereas ours was 0.8%. A study from India found the incidence to be 1.1%. Overall, the prevalence of psoriatic arthritis in children is between 1 and 10%, and it's most common in the ages between 9 and 12 years. Its presence correlates with nail involvement, and the skin manifestations of psoriasis often precede joint involvement. Then we classified psoriasis according to the severity into mild, moderate, and severe. And fortunately, we only had 13% of patients with severe psoriasis, 45% had mild psoriasis, and 41% had moderate psoriasis. Then we cross-tabulated severity of psoriasis with gender, because there are certain international studies which claim that boys have more severe psoriasis. However, we found no statistical significant association between severity of psoriasis and gender. We also measured their weights and heights and found, in contradiction to international data, we found that we had 64% of patients were underweight, 37% of patients, 37 patients had a normal weight, while 10 patients in total had either obesity or were overweight. This is totally in contradiction to international data, where a statistically significant association has been found between pediatric psoriasis and obesity and being overweight. The association is dependent upon the severity of disease, where moderate to severe psoriasis patients have higher odds of obesity compared to mild psoriasis. In a meta-analysis from Australia, where they compared over 43,000 patients with 5 million controls, they found that there was significant association with obesity. Further, a French study also confirmed this finding, that abdominal obesity and just being overweight and obese is more common in psoriasis. A Turkish study also agreed with this. So since our study did not find this, in fact, we found that we were mostly had children were underweight. So we looked at our own studies, and I found that one study from Lahore, which studied an affluent group of children from a well-to-do area, where we found that 33% were overweight or obese. This is normal children, just looking at the rate of obesity in our population. So this doesn't go with our study either, because this is from an affluent population, whereas our patients were from all social strata of life. Then we've looked at another study. This is from Laya in district from Punjab, where we found that 60% of patients were underweight, while 70% were overweight. So this is more in keeping with our study, but because of these studies, now we've decided to extend our study and add age and gender matched controls to find out whether the incidence of malnutrition or being underweight and the incidence of obesity is in line with what the general population has, or is it in any way different. So in conclusion, pediatric psoriasis is a fairly common condition. Girls are more commonly affected. There's 3 girls for every 2 boys that have psoriasis. Most of the psoriasis disease is mild or moderate. Severe is fortunately uncommon. 18% patients have a family history of psoriasis. There is no association with obesity. Arthritis is relatively rare, and pitting is the most common nail change. And of course, like we said, there's a plan to extend the study to other centers and to also include age and gender matched controls to make the findings more valid. Thank you.